Welcome, everyone. My name is Clara Watts, and I'm the president of the League of Women Voters of San Jose, Santa Clara. I want to welcome you all today to our third Thursday Lunch with League. We're very happy to have Michele Liu of the Health Trust with us today. But before I introduce her, I would like to welcome new attendees to our virtual luncheon. I think we have some students from Presentation High School. Today, our VP, Sandy Morey, is helping to host our event, and we will be asking the questions that you enter into chat. So if you think of a question during Michele's presentation, don't hesitate. If you prefer to ask your question yourself, you will have that opportunity. So we're so pleased to have Michele Liu today. She is an active community leader in Silicon Valley and has been for over 20 years. She began her tenure as the CEO of the Health Trust in January of 2018. Previously, Michele served as the local government and community relations director for Stanford Healthcare. She was president and CEO of the Asian Americans for Community Involvement from 2005 to 2016, which is a nonprofit health organization. She's also served as district director for California State Senator Assemblymember Joe Simitian. A Santa Clara County native, she holds a BA in economics from Yale University and a master's in public policy from Harvard. So she will now tell us more about the Health Trust and the challenges and responses in hard-hit communities of our COVID crisis. Michele, welcome.
We have been enjoying a healthy endowment, and we also inherited some direct service programs of the old nonprofit hospital system. So today we continue to do Meals on Wheels, which was a legacy program of the hospitals. We also continue to be an HIV/AIDS service provider in Santa Clara County, providing an array of case management services for people living with HIV/AIDS. And that too was a program from the old hospital system. Karen, next slide, please. So for us at the Health Trust, our mission is to build health equity in Silicon Valley. What do we mean by that? For us at the Health Trust, we recognize that equality and equity are two different things. If we were focused on equality, we would make sure that everybody had the same level playing field. But in reality, we know that for many reasons, some systemic, some more individual, but for many reasons, some people might need a little bit more support than others in order to take a healthy bite of that apple. And so our job at the Health Trust is to make sure that everybody has the support they need to be as healthy as possible. Next slide. At the Health Trust, we focus on 3 areas. Health is a pretty broad topic, and so we have tried to really concentrate on these 3 areas: improving health through food, making chronic diseases more preventable and manageable. Again, that includes HIV/AIDS as well as other chronic diseases such as diabetes. And then thirdly, we are focused on prioritizing health and housing. I probably don't need to tell the League that housing and affordable housing is one of the top issues here in Silicon Valley. And we want to make sure that we are helping people get housed, stay housed, and then once they are in housing, helping them to prioritize their health. Next slide. So the Health Trust has these 3 focus areas, and we also have 3 target populations. As I just mentioned, we're focused on people who have been chronically homeless or are hopefully recently housed. Many of these folks have complex health conditions and multiple chronic conditions. And so we want to make sure that they can be as healthy as possible once they're housed. We also have a strong focus on older adults. And I'll talk a little bit more later on about our Meals on Wheels program. And then thirdly, we focus on folks who have chronic diseases. Today, we are the largest community-based HIV/AIDS service provider in the county. And we also recognize that there are hundreds of thousands of us who are struggling and managing chronic diseases. Next slide. So 3 focus areas, 3 target populations, and the Health Trust is able to play 3 different roles in the community. As I mentioned, we are a health trust. We are very fortunate to have an endowment of over $100 million. And those funds and the interest that we earn on them help us play a role as a grant maker in the community. So every year we give out between $2 and $3 million a year to other community-based initiatives that are helping to build health equity in Silicon Valley. We also provide direct services ourselves, services inherited from the old hospital system, as well as newer services where we have seen unmet community need. And thirdly, we play a role as a policy advocate. Perhaps more in the last year than ever, we have seen the need for local policy advocacy around health equity. And we have also been doing some work at the state level to support legislation that helps people be as healthy as possible. And next slide, Karen. This slide has a lot of words on it. It just tells you a little bit more about what we do as a provider. We offer an array of different programs in those focus areas of food, chronic disease, and housing. And now I want to turn to talking a little bit about the work we've done as a food service provider during the pandemic. Slide, Karen. So, as I like to tell people, in February last year, the Health Trust was perhaps known as a more boutique-y, small Meals on Wheels program in Santa Clara County, focused on the very frail elderly who were homebound with chronic diseases. Then mid-March happened, and our world, like yours, turned upside down. Our traditional Meals on Wheels program relies heavily on volunteer drivers, many of whom had to shelter in place themselves when the shelter in place order went into effect in mid-March. At the same time, the phone started ringing off the hook because so many more people now were homebound and needed meals delivered to them. And so the spring was all hands on deck here at the Health Trust and with our sister nonprofit meal providers. As you can see from this line graph in front of you, between March and May, we started to deliver about 600% more meals than we had been doing in February. As the graph will show you, demand has leveled off, but we're still, even now in February, we're about triple the number of meal deliveries that we were doing pre-pandemic. That is because we have so many more homebound seniors, people with disabilities. We want to make sure they are getting healthy, nutritious meals. And we have been very fortunate to recruit new staff and volunteers who don't have to shelter in place and can help us get those meals out the door. Next slide, Karen. So what is Meals on Wheels? In some ways, it's just as the name describes. We provide home delivered meals to people who are homebound, but Meals on Wheels is also much more than a meal. So right now, depending on what a client needs, we do weekday deliveries of home meals. Sometimes the meals are hot if people can't heat up meals themselves. More oftentimes we deliver frozen meals, and we have the capacity to deliver breakfast, lunch, and dinner. On Fridays, we typically bring extra meals for folks so that they can put them in their freezer or their refrigerator for the weekend. What we really like about our program is we have a registered dietitian on staff who prepares every menu for the chefs who cook the food. So we're the Health Trust, and we care deeply about making sure people get healthy, nutritious food that sustains their health and maybe even improves their health. One of the other things that we love about our program is our Meals on Wheels drivers are trained, they're background checked, and they do a wellness check every time they deliver food. So they are trained to make eye contact, face-to-face contact with the client. And if the client doesn't answer the door that day, or they do see the client, but they seem different than they usually do, our team is able to quickly call our central office, and our central office can call that client's emergency contact or 911 if necessary, and make sure that people get the support they need. And so our drivers have been true heroes in recognizing when sometimes clients accidentally turn their gas stove on, and because their sense of smell is diminished, they don't know the gas is on. So our folks have prevented explosions. They have been able to call for medical help when people are having a medical issue. And it's just a wonderful service for not only the client, but for their family members and loved ones who worry about them. During the pandemic, sometimes the Meals on Wheels driver is the only person that some of our clients are seeing. And so they have really been just a wonderful service and a way to reduce social isolation among homebound seniors. Next slide, Karen. So we have this wonderful sister program that accompanies Meals on Wheels called Friends from Meals on Wheels. I just mentioned social isolation, and that is a real issue for many of our clients, especially folks who don't have loved ones nearby. And so for some clients, we recognize they need even more social support. And so we have an incredible team of, again, staff and trained volunteers who pre-pandemic would do house calls, sometimes weekly. You'll see a picture here of one of our friends visiting one of our favorite clients, Bob. You can't tell from this picture, but Bob is blind, legally blind, and he also loves karaoke. So you'll see that picture of him with his giant karaoke machine. His friend has really been able to check in on him. She is the one who recognized that Bob's karaoke machine had all kinds of cords, and he had space heaters, and there were some pretty serious tripping hazards, especially for someone with poor eyesight. And so she was able to help create a safer environment for him. She also arranged for him to get some in-home support services in addition to friends, just to help him be more independent at home. And you'll see his quote. He's 87. And he says, Friends for Meals on Wheels is such a wonderful thing because, man, oh man, I get so lonesome. And when they come, it makes my day. And so the friends are able to help with everything from maybe exercise to just having a friendly conversation and reminiscing about old times. During the pandemic, much of this work has had to shift to Zoom, like us, and to phone calls, but we have also been able to arrange some safe outdoor, mass, socially distanced in-person visits for folks who would benefit from that. Next slide, Karen. As I mentioned at the start, one of the populations we care deeply about is people living with HIV/AIDS, and we are mindful that the population of folks living with HIV/AIDS is getting older. For, I think it's mostly good news that HIV/AIDS has become a chronic disease. And just as we're seeing with our Meals on Wheels clients, we are seeing challenges among our older adults living with HIV/AIDS. Folks are exhausted from the treatment regimens. Now they might be battling not only HIV/AIDS, but other chronic conditions such as hypertension. They too are socially isolated, especially because many are immunocompromised. And there's some mental health challenges sometimes about people feeling survivor's guilt of, why am I still living when many of my peers have passed away already? We're blessed to have a team of case managers. Some are registered nurses and some are non-clinical, but they provide a range of support services for our clients living with HIV/AIDS. Next slide. So that's a lot about the Health Trust. I want to talk about what is happening more globally in Santa Clara County. Here is a slide that shows a map of Santa Clara County from Palo Alto to Gilroy in the south. And the dark blue sections are the areas in our county that have the highest number of COVID-19 cases. For many of us, alas, this slide is not a surprise. We are seeing the heaviest cases in East San Jose and downtown San Jose along 101. And then we're seeing high case rates in South County, primarily Gilroy, and a growing number of cases in Morgan Hill. This is a virus that is affecting everyone in our county, but for the Health Trust and our focus on health equity, we've really been focused on what do we need to be doing for the hardest hit communities. Next slide, Karen. So this slide that we took off the county website earlier this week shows COVID cases by race and ethnicity. And you'll see for the Latino population, they make up about 26% of the county population, but more than 50% of the COVID cases. This is a statistic that is very troubling. It probably has deep roots in systemic racism and land use planning and economics, but it's something that we can't turn a blind eye toward anymore. Next slide, Karen. So when we saw the initial results on case rates that came out last spring, we recognized, wow, we need to do a better job at meeting the needs of the Latinx community, the Latino community. And we also saw that the death rate from COVID for African-American and Black residents in our county is disproportionately high. And so for the last year, the Health Trust and other community advocates have really been pushing the county to do more COVID testing and support services in the hardest hit communities, in the hardest hit zip codes and census tracts, and making sure that materials are available in multiple languages and services are available. Fast forward to early 2021. Now, as I'm sure you know, and probably are experiencing yourself, we're in the throes of vaccination efforts, which I think could only be described as chaotic and confusing. You will see on this slide COVID vaccination rates by race and ethnicity. The blue sections show the residents vaccinated, and the light gray shows the residents who have not been vaccinated yet. This is the folks who are eligible given the vaccine eligibility parameters right now. So what this bar graph is showing us is that, again, the Hispanic Latino rate of vaccinations and the African American rate of vaccinations are dramatically lower than they are for the Asian and white communities. This is particularly troubling if we know that the case rates are the highest among Latinx and Black populations. We really need these populations to also be doing well and getting vaccinated, and the data are not showing us that. Next slide, Karen. So we know what the challenges are, and we also recognize there's some promising solutions out there. So as I mentioned earlier, testing continues to be a high priority. We want people to know if they are testing positive for COVID. And so we need to make sure that people know about testing locations, they feel comfortable going there, they know someone will speak their language. And the county has done a good job at establishing sites at Black churches in the heart of East San Jose at the Mexican Heritage Plaza, and making sure that testing is available for folks. We and other community advocates have also pushed hard on our county, as well as the city of San Jose, where most of the cases are, just given the population. We've been pushing that once people test positive, residents need additional support services. So one of the things that we have heard is that folks are reluctant to get tested because if they test positive, that could mean they can't go to work, they would lose wages, that could have a spiraling effect on whether they can pay their rent. And so people just don't want to even know if they have COVID. So we have really been advocating for better isolation and quarantine support for families. So if somebody tests positive and they live in a multi-generational household, they can easily move into a temporary motel room where they can stay safe and isolated. Their family can be safe. Meals, healthy meals will be delivered to them at the motel, and their family can also get some cash assistance to be able to cover rent and cover groceries, etc., for the household. Now that we are moving into the vaccine world, you might have seen that the county has opened up a mass vaccination site at Levi Stadium. That is great. What community residents have been telling us is that we need a both and strategy. So yes, Levi Stadium, but we also need more community-based, grassroots, easily accessible places where people can get vaccinated. Not everybody can, I'm thinking of my own family members, not everybody can navigate the online appointment system. Some folks are reluctant to give the government any of their personal information. And so we need a mix of stationary sites in the community where people can make appointments. We want to have pop-up sites where anybody can walk up and get a wristband with an appointment time and then just show up for their appointment. And we also know we need some mobile vaccination programs. So we think a lot about our homebound Meals on Wheels clients. Because they are homebound, they qualify for Meals on Wheels. And that means it's even more difficult for them to get out to one of these vaccination sites. And so they may need somebody to come to their home and give them their 2 shots. I want to talk about some of the barriers and challenges that we're seeing right now. Probably no surprise to you, vaccine supply continues to be an issue. We remain hopeful that that issue will get addressed, but certainly don't have a date of when that might happen. You, like I, have probably experienced that the messaging around vaccines and when people are eligible and where to go has been confusing. I speak English. If I didn't speak English, I'd be probably even more confused about what is happening and when is it my turn. There is significant fear and mistrust, especially in communities of color, about vaccine safety, about sharing personal information with the government. These fears and mistrusts are not necessarily unfounded. And we believe there are active misinformation campaigns happening right now, targeting some of our most vulnerable communities. Even if you can navigate the online appointment systems, for many of our most vulnerable residents, lack of access to computers and internet is a real issue. And so that's something that we continue to need to address. And of course, transportation, it again is great that there's a Levi Stadium site, but for folks who don't have a car, for folks who might need to take public transportation, that site can seem like it is hundreds of miles away rather than 10 miles away. The good news is there are a number of community partnerships happening to jointly address this challenge that we're in. To the county's credit, they established a vaccine stakeholder group made up of about 200 different community members who are diverse in all respects to help advise the county on effective vaccine messaging, on effective strategies. They are giving very helpful feedback, such as if you make an appointment for a vaccine, it seems very difficult to cancel it or reschedule it, which is probably leading to some of the relatively high no-show rates that we're seeing. And so this group is giving feedback to the county on a daily basis to help improve our local systems. At the same time, the county has also launched what's called a COVID-19 Community Ambassadors Program. And some of you might actually be participants in that. This is a way that the county can share science-based, fact-based vaccine information that then ambassadors can share with their own networks. We are finding that word of mouth is really a popular strategy and an effective strategy. So the county is trying to ensure that people are sharing accurate, helpful information. The Health Trust is part of a health and racial equity task force that is chaired by San Jose City Council member Magdalena Carrasco, and the vice chair is County Supervisor Cindy Chavez. They represent districts that have been particularly hard hit by the pandemic, and they have convened a group of community health leaders to help inform strategies at both the county and the city level. The county and city are also supporting what is called Community Health and Business Engagement Teams, or CHABET, for lack of a better term. And these are really on the ground, community-based organizations who have built trusting relationships in their communities. This is groups like the Roots Community Health Clinic, which serves the African-American community, as well as Somos Mayfair and their partner organizations in East San Jose. And they are doing door-to-door work. They have done door-to-door testing. Hopefully they will be doing some door-to-door vaccinations, and really working to help educate the communities on the ground where people live. And they are doing that with a group of trained volunteers and staff who are called promotores, or lay health workers. These are folks who are neighborhood leaders. Their kids go to school with other kids at the neighborhood. And we're finding that they are sometimes the most trusted ambassadors for COVID information and education. One more slide, Karen. So as I wrap up, I wanted to end on a more uplifting note. We have many challenges, but there is some great work going on, not just by the Health Trust, but by many, many partners in our community. And we just want to end this presentation with a hopefully uplifting story. Karen.
Workers at the food basket in San Jose preparing food for Meals on Wheels handed off packages to 10 Santa Clara County Sheriff's deputies who agreed to help the nonprofit Health Trust after coronavirus precautions depleted volunteers.
In this pandemic, we are dramatically ramping up Meals on Wheels. We need volunteers to help us sort food. We need volunteer drivers, and we need cash donations.
Thank you so much. God bless you.
In all, deputies delivered meals to about 40 homebound people.
I think it's awesome the sheriff's department stepping in, and for me to get this, I can't survive without my Meals on Wheels.
Deputies say volunteering helped lift their own spirits.
It's definitely an eye-opener for me that I didn't realize that how much service they're providing to the community, Meals on Wheels, and you know, there's something very important and essential part of our community that we need to keep going.
Recipients definitely agree, especially in the midst of coronavirus fears.
I'm so happy that they're still coming through for me. It's awesome. I'm blessed. I'm too blessed to be stressed.
That is a good thing to hear nowadays. Too blessed to be stressed. You just heard my new mantra. In San Jose, Robert Honda, NBC Bay Area News.
Thanks so much, Karen, for sharing that video. It's something I think about on the more difficult days. We are very fortunate at the Health Trust. We're too blessed to be stressed. There's lots of work for us to do. And if you have questions, comments, or suggestions, we have time now, but if something comes to you after this session, please don't hesitate to reach out to me via email or my direct phone number on the screen. We are open every day to new ideas and suggestions, and would welcome any feedback from the league. I'll stop now and turn it over to Sandy to field some Q&A.
Okay, thank you for that wonderful presentation. It's good to hear all the good things that are happening. First question is, the vaccine misinformation that you mentioned, is that because of ignorance and rumor, or is there a deliberate effort to mislead people?
Thanks, Sandy and Diane, for that question. I would say it is all of the above. There is ignorance and misinformation through the rumor mill happening. One of the things we're excited to see the county do is have some frequently asked questions on their website now, because we've heard questions from everything of, if I get the shot, does it change my DNA? To lots of questions about how fully vetted the vaccines have been. And so there is an active effort to make sure we're sharing scientifically based factual information in multiple languages. At the same time, we are concerned that there are intentional misinformation campaigns happening, and that there is a movement from the right to equate saying no to getting a vaccine to exerting your rights and your freedom. And at this point, I think all the public health experts are saying everybody should get vaccinated as soon as it's their turn. It is in the best interest of public health, and that is the message that we're trying to help get out.
Thank you. Next question, can your Meals on Wheels drivers be trained to administer the vaccinations?
That's a great question. I think our Meals on Wheels folks feel like it is best if they stay in their lane, if you will. Having delivered a few Meals on Wheels myself during the height of the pandemic, it's kind of a job in itself. You are carrying the meal. There is also a beverage. There is a fruit and a roll. And just getting all of that stuff to the door in a safe way to hand off, I have realized firsthand is a bit challenging in itself. But one of the things we're doing is talking with the county to make sure that our Meals on Wheels clients are going to get called about when it's their turn to get vaccinated and get information from a trusted source on where they can go or when a mobile van might come. And then hopefully our Meals on Wheels drivers and whoever is doing the vaccinations can go together. We and other senior serving organizations have been very cautious about who is talking to our folks about vaccines. We're very wary about scams. This is a very vulnerable population. And so we want to make sure that whoever is, especially going into homebound seniors' homes, has been vetted and background checked and is the right person to be there.
What pops into my mind is public health nurses, but I don't know if, having been one. Please comment on your relationship with Destination Home. Please talk more about your advocacy related to affordable housing and homelessness.
Yeah, I don't want to take any credit because Destination Home has done their own incredible job, but the Health Trust was the original home of Destination Home. So we helped incubate the organization and served as their fiscal sponsor in their early years. They have now transitioned to a better fiscal sponsor, which is the Silicon Valley Community Foundation. But we are co-located with Destination Home. So we share office space, although these days, not too many of us come into the office. Destination Home has done some tremendous advocacy work around building permanent supportive housing in Santa Clara County. This is housing that has embedded social services and mental health services on site for the residents, many of whom have been chronically homeless, for the residents who are living there. The Health Trust has joined Destination Home in advocating for local bond measures to support the building of affordable housing and permanent supportive housing. And we have also, as the Health Trust, done some successful advocacy work with the City of San Jose to ensure that as new housing developments get built, that there is a food access plan for residents who live there. So that might be a shared kitchen, it could be a healthy food pantry. And through our work as a grant maker, we have funded partners such as First Community Housing, which has developed several permanent supportive housing sites in San Jose. We have helped them with building rooftop gardens and training residents to be master gardeners there, so people can actually grow their own food, be outside, be in community with other residents, and eat healthy vegetables.
I'm going back to Meals on Wheels. We do have some students here today from Presentation High School. And one of them asks, is there a way to help deliver the meals as a high school student?
Oh, what a fantastic question. So the short answer is yes. I believe our current age requirement is 16 plus. So it's, helpful if people can drive, because most of the Meals on Wheels need to be delivered by car. But in addition to that, we have a number of other volunteer activities that include packaging grocery bags for some of our clients living with HIV/AIDS. So some of our clients are healthy enough that they just need groceries and then they can cook their own meal. Whereas for our Meals on Wheels clients, it's usually folks who are not able to prepare their own meals at home. So we would love for folks of all ages to check out our website, healthtrust.org, and there's a section on volunteer opportunities. And we have a great team of volunteer coordinators who can help figure out where is the right place for you.
How can the League support the role of the Health and Racial Equity Task Force?
Oh, what a great question. So the Health and Racial Equity Task Force put forth a set of recommendations, about 30 recommendations, late last summer. And I am happy to share the document with Sandy and Carol after this talk. The good news is many of those recommendations have been implemented since the summer, but there are still areas where we need more advocacy. One of the things that both the Health Trust and Destination Home are very, very worried about is what happens in our community once the eviction on rent, the moratorium on evictions for not paying rent, what happens when that gets lifted? We know there are families in our community who have lost their jobs, they are not able to pay their rent. Is everybody going to get evicted when the pandemic is over? That has major implications for our society, for food insecurity, let alone homelessness. And so we need the best minds and strategies and advocates to help us figure out what comes next. Once the coronavirus pandemic is declared over, we know that there will be years more repercussions for us as a community.
I think you may have touched on this already, this next question, but I'll ask it and then you can say, yes, I've answered that. What are the plans to vaccinate the homeless?
Great question. So the county has this incredible team called Valley Healthcare for the Homeless program. And it is a team of doctors, nurses, and non-clinical folks who go into encampments. They seek out homeless folks, and they are able to give vaccinations wherever people are living. And so I believe that has already started for folks who are over 65. As you've probably seen this week, the eligibility criteria for who gets vaccinated is starting to open up. There will be a new large population who can get vaccinated as of February 28th, and then an even bigger population come March 15th. And so the county is well aware that these are folks who should have priority to get vaccinated.
Okay, thank you. One of our league members asks, how can we help?
Oh, just the league is always helpful. Thank you for that question. I think helping us get the word out about where to go for vaccinations is really important. We are steering folks to the county website, which is sccfreevax.org. So sccfreevax.org. We feel confident that this is a site with helpful, verifiable information. We have also encouraged the county to simplify their website because it's getting pretty complex. The coronavirus is certainly complex, but one of the things we advocated early on was that the county needed some dashboards that had easy to find information about who's getting tested and case rates and death rates. And so that's good news. The bad news, or less good news, is I was on the county website yesterday and now there's like 30 dashboards. And so we just need to figure out ways that we are effectively communicating with busy people and making sure we get the word out. We also, again, we would love volunteers and donations for Meals on Wheels. I forgot to mention, most of our clients are low income. We have a few private pay clients, but most of our folks are low income, and really we see folks who are getting by on $800 a month to pay for rent and food and clothing. In Silicon Valley, that is not a lot of money. And so your donations go a long way to supporting people in need.
Following up on that, what are your primary funding sources for your programs?
Yeah, so as I mentioned early on, one of the great gifts of the Health Trust is we do have $100 million in the bank. And so we use earnings off of that endowment to fund our sister community organizations. The good news, bad news of our founding was we at the Health Trust are governed by an unusual state attorney general's agreement. So one of the requirements of that is that our assets be used to support community efforts. At the same time, the Health Trust is running our own programs, and so we are also fundraising from outside sources to support our direct service work. Our primary funder is the county of Santa Clara. We also get funds from most of the local cities in Santa Clara County, primarily for Meals on Wheels. And then we have a base of foundations and individual donors who support our work as well. One of the things we love is the number of individual donors for Meals on Wheels. We frequently get $10 donations, which is fantastic, from folks who really see the need for Meals on Wheels.
That's good. Does the Health Trust still operate children's dental centers? And if yes, how has the pandemic impacted this program?
Yes, and I want to thank Karen for correcting my misstatement, which was my bad, about the county vaccine website. It's freevax.com. So the Health Trust has had a long history with children's dental health or oral health. We originally started by running a couple of dental centers ourselves, one in East San Jose and one in Sunnyvale. Frankly, what we found was important service, very difficult to sustain financially, probably because the Health Trust is not a professional operator of dental clinics. And so my predecessors, to their credit, they then went out and found a business partner who had more experience in running dental centers. And they were able to take over the practices and run them much more efficiently. At that point, the Health Trust pivoted to focusing more on advocacy around water fluoridation. And this has been a decades-long process. Water is very complicated, we have learned, especially in Santa Clara County that has a number of well systems and multiple players in the water industry. But slow and steadily, we have been getting more fluoridated water. San Jose is actually one of the last 4 metropolitan areas that doesn't have fluoridated water throughout. So the dental centers are now operated by a private entity with the shelter-in-place orders. They, like many small businesses in this last year, they have closed and then opened and then closed and starting to open with social distance requirements. And we're very grateful to the Healthier Kids Foundation, a sister nonprofit locally, who has sustained oral health education work. They used to go into schools and do oral health education. Now they've moved into the Zoom environment like a lot of us, but I know they eventually hope to get back in person to help educate kids about the importance of toothbrushing and flossing and good oral health.
Roma Dawson has a question that she would like to ask you.
Oh, hi, Roma.
Hi, Michele. First of all, thank you for all these years of service you've given to our area. We really appreciate it, your good work. I'm just wondering if you mentioned advocacy on the local level and at the state. Do you ever put out a list of bills that you're watching or that you support, or is there some way we can know what the Health Trust thinks about legislation?
Thank you for that question, Roma, and thank you for all of your incredible civic work over the years. So last November, for the first time, the Health Trust did publish a voter guide with our positions on some but not all of the state and local ballot measures, and that is something we hope to continue to do. This year, we're really excited. We are sponsoring or co-sponsoring 2 pieces of state legislation. One is around making insulin more affordable for folks. So insulin is a life-saving medication for diabetics, and we don't want local residents or any residents having to choose between buying insulin or buying food or paying rent. And so we are working at how do we work on both a state and local level to make insulin and other life-saving drugs affordable for all. We are also, for the first time, sponsoring a bill to educate physicians about hepatitis B and hepatitis C, which are diseases that disproportionately affect communities of color. And so we are working with the Stanford Asian Liver Center, which is an internationally renowned operation, to try and encourage and incentivize physicians to learn more and encourage their patients to get tested for Hep B and Hep C.
That seems to be all the questions that have been submitted from the group today. I think you've done a wonderful job giving us all the information. We have a lot to think about.
Thank you so much.
Thank you.
Great to be here.
Yes, thank you, Michele. It's just great. I know I've learned so much, and I appreciate hearing so much about your organization and all of the wonderful works that you've been doing. So if anybody has any more questions, we could take some more. If not, I want to encourage you all to sign up for our next Lunch with League, which the sign up isn't there yet, but it will be soon, which is March 18th, the next third Thursday, where we will welcome Jeffrey Rosen, who is the Santa Clara County District Attorney. I think this will be a very, very interesting conversation. So I thank you all very much.